welcome to the podcast. The Aging Queen. Welcome to the podcast. Welcome to the podcast. Welcome back to another episode of The Aging Queen. I'm Louis Canetti, and I'm here with one of our regular guests. Robert lives in Madrid. Hello, Robert.
Hi.
How are you? How are you today?
Great. It's a national holiday, but
Oh, nice.
still having a good day.
Oh, good. So today's topic is one that's been on my mind for a while, even though I'm not there yet. Who will take care of us or take care of members of the LGBT community when we are older? A lot of us won't be having kids or aren't having kids, don't have kids. Not to say that having kids guarantees that they will take care of you when you're older, but um,
Right.
so I think that's something that we should discuss. We found some statistics, and there are some communities out there that cater to LGBTQ queer community retirees. But yeah, let's open up the discussion and see where we're at, what we get from this. Rob, do you have any opinions or on retirement communities for gay people, for instance?
Me, myself, I have no idea what I'm going to do when I retire. I'm going to be turning 40 next year, so I should start thinking about it, but who knows?
No, 40 is
Um,
too young, but yeah, with the age difference of your husband and you is how much,
yeah,
20 years? Or?
20 years. Yeah, he's 20 years older than me, so he's got to think about retirement, and me, I'm gonna have to think about his retirement before I can think about mine. But yeah. Long
Will you
story
be take,
short, I don't know.
will
Just I
you be in
think
charge of taking care of him, I'd say?
probably. I hope he will be in sound mind and judgment. So we don't own a house or anything, so it's kind of a sore subject that I don't really know the ins and outs of. Buying
But,
property here,
but you're living in
retiring
Europe,
here.
so there's a huge uh,
Yeah.
social
There,
net. To,
we'll have state pensions, but they're not going to
Mhm.
be amazing, just like
Right.
state pension in the US. But oh well, we'll see how it goes in the future when the water wars happen and we all have to live underground.
Okay, let's hope it doesn't get to that. Um, yeah, no, my biggest worry is the not having kids portion. I see my parents now; they're both still around, thank God, but they both have needs that us as their kids take care of their needs in different ways. The ones who live near take care of them more day to day, but we still take care of them in that sense. They do
Right,
as much as they can, and then we look after them. Um, but for gay people or LGBTQ queer spectrum people who don't have kids, for instance, or even straight people who don't have kids, I guess the worry is real, and it gets even more real as you age because you start seeing that the clock is ticking and we're not getting any younger. So,
TikTok. We're not
TikTok.
getting any younger.
So there's some statistic here that we found. Rob, I don't know if you want to say something about something that you've done a little research on.
Yeah, sure. First bit I found is that LGBTQ elders often face unique challenges in accessing health care. According to a
Wow.
study by the National LGBT Health Education Center, 29% of LGBTQ plus individuals have postponed or avoided medical care
Wow.
due to discrimination, in comparison to 17% of non-LGBTQ plus individuals.
Wow. Why
Now,
do you think that is?
stigma, fear, judgment, fear of judgment, fear
Hmm.
of, or maybe even lack of access.
Yeah.
Um, there's got to be, it's definitely also got to be intersectional. There's got to be different layers to it.
Right.
But here in Spain, we do have for the time being at least, we do have a national healthcare system
Mhm.
that citizens and residents have the right to access to. And it's relatively good. I mean, that's another topic, the quality of it, but
Right.
um, people here do not shy away from going to the doctor. Every time I visit the medical center here, the it's mostly older people in the waiting rooms,
Right.
probably because statistically they have to go more often, but also because it's their right and they see a lump, they go see someone.
Mhm.
They see a discoloration on their skin, they go see a doctor.
Yeah,
They're
well, the
not
healthcare system
scared.
here in the US is a big topic, a whole 'nother topic, a whole 'nother many topics. But I'd say for for elderly people, the healthcare is quite good, the Medicare. I
Once
think
you hit
they're
that age,
once you
yeah.
hit that age, yes. And Medicaid, so basically if you're poor or old, the system is good. But if you're of working age and middle class, it's expensive. It doesn't cover much. There's a lot of work you have to put in and get authorizations and referrals and out of pocket expenses and and co-pays. It's just never ending. It's dizzying. But putting that aside, I think one of the biggest um, I would say caveats is also the stigma, for this statistic. I can tell you from personal experience, I had a doctor in LA, and once there was that little monkeypox kind of like outbreak,
Mm.
and they were saying that people of the community should get vaccinated. I said, "Hey, I'm going to try to and look into this. I'm going to ask my doctor." My doctor referred me to the LGBT health center in downtown LA. And I find it a little strange that because you can get monkeypox vaccines anywhere, and why would he not recommend I go to, I don't know, a closer hospital or another health clinic, or him administer it himself?
Right. Why is it in a quote unquote ghetto, you know?
Right, right. I mean, it's kind of, yes. I didn't want to say that word because but it's why do I have to go to that health center where people don't know me, and just because there's a stigma if it's a gay thing, the
Mm-hmm.
monkeypox.
Yeah.
Was it a gay thing? I don't know, but it was running rampant at that moment about 2 years ago in
Oh
the
yeah.
community, especially in the West Coast. So, it's kind of they wash their hands of it. They don't know how to deal with it. Is it the same as like when cops have to deal with, people of the other gender and they bring in a female cop? I don't know. I don't know how innocent it was that he referred me to that gay health center,
I don't
but
know, maybe the other gay health center just had more resources and they just had
well,
less
they
of a waiting
didn't,
time,
because when I
maybe?
actually
No?
called, there was like there was a line, and there,
Oh.
I think they could have handled it a little bit more widespread. So
Mm.
that's why, maybe some
In
people.
Madrid, getting the monkeypox vaccine was impossible. It was all online. You had to fill out a form online. You had to
Mhm.
wait until after midnight until everything was refreshed. And I tried multiple times, even though I didn't really need the vaccine,
But did you have
I
to go to
still
a
wanted
specific
it.
place where they catered to only gay people?
No, absolutely not. It was a couple of hospitals in the center of Madrid and on the outskirts of Madrid, but I didn't even get to that part of the formulario of when you fill out the sheet.
Right.
I didn't even get to that part where you could choose the hospital, quote unquote, choose it. There was only like three or four that you could choose, and yeah, I didn't even get to that part because all the appointments were taken no
Hmm.
matter how hard I tried.
Wow. Well, maybe there is something positive about having it all streamlined into one health center. I don't
Mm,
know, but I feel that that's a statistic about challenges in accessing healthcare
mm,
could also be. because people have avoided medical care due to discrimination or feeling that they are going to get put into some kind of, you have a personal relationship with your own doctor already. So if you have to go to a whole nother health center that they don't know you, fill out paperwork and tell them things about your private life, it's just,
It's a big rigmarole that people shouldn't have to go through. Yeah.
and that's why they avoid it.
Mm.
Another statistic, aging without family support. LGBTQ elders are more likely to age without traditional family support structures, according to a report by the Movement Advancement Project. 49% of LGBTQ plus elders are concerned about relying on family for support as they age, compared to not 39% of non LGBTQ elders. So that goes in line with my little worry of being in my mid 40s and starting to think about who is going to take care of me, or how am I going to be taken care of when I'm older. I do have some nieces and nephews, and they're probably listening now and saying, "Ho, ho, ho, step away from me because I am not going to take care of you." You hope
Hmm.
that, you will get some kind of family support, but at the end of the day, it's not their responsibility. Whose
No.
responsibility is it, if any's? It's yours, but you have to kind of find something that works for you. It's either, um, you know, set it up when you're younger and have some kind of pension plan for retirement that includes also nursing, a nurse, and some kind of, residency, like, as they say, the in retirement homes. A lot of people don't want to be in retirement homes, though.
Yeah, a lot of people can't afford it either
No, they're very
because,
expensive.
yeah, here's another stat about financial insecurity.
Mhm.
LGBTQ elders are more likely to face financial insecurity in an older age. A
Mhm.
report by SAGE, which is the Services and Advocacy for LGBT Elders, found out that LGBT elders are twice as likely to live in poverty compared to heterosexual elders, and transgender elders face even higher rates of poverty.
So there's still
So,
there's still a lot to there's still a ways to go, in
yeah,
advancing to level the playing field, it looks like.
when we're younger, we're dinks, double
Mhm.
income, no kids, but
Mhm.
that doesn't translate into longevity and aging successfully
Right,
always.
right.
So, yikes.
So there's gonna have to be, and there already is. I see some places online, that especially in Palm Springs, California, that have an entire gay
Community.
village. It's a
Yeah.
retirement village, for catered to LGBTQ retirees. Some are also in Florida, and I'm sure there's tons abroad. So I think you just have to find your way, and it's a conversation you need to start having early on with your
Hmm.
partner and with your family.
Oh, yeah.
It's one of those kind of realistic conversations that, is uncomfortable, especially when you're talking about something that you don't know how it's going to pan out in the future,
Right.
if you're going to be with someone or if you're going to be alone. It's something that everyone needs to start thinking about, especially after 40, for sure. Um, you know, anyway, a little food for thought. But yeah, looking at some of these statistics, they're
It's not
kind of,
looking good.
yeah, I mean, wow. Okay, social isolation. Also, many older LGBTQ individuals experience social isolation, which can have detrimental effects on mental health. A study published in the American Journal of Public Health found that LGBTQ elders are twice as likely to live alone compared to heterosexual elders. They say that many news channels, and say that there is an epidemic in America, especially, and it's called loneliness.
Mm,
And uh, elderly folks know this way too well.
yeah.
When you are older, you are more prone to loneliness. Social interactions come less frequently. And it looks like if you're gay, they come even less frequently. So
So next time you
people
see an old person, give him a
give them a
hug.
hug.
Well,
Give
ask for
them a hug.
consent.
I
Well,
think
don't
it's
give him a hug, but like think about giving him a hug, a mental one from a distance.
I think it just
Be
comes
nice to
down
them.
to it's also just being less selfish and also taking care of other people's needs and being around for people. If you see, I have a neighbor that's older in their 80s, and he's always a good chat. We have
Yeah.
um, conversations sometimes when I walk the pooch. He walks with me,
Hmm.
and it's just
Oh,
and it's just very nice to talk to a person of a different generation, different perspective. That's why I started this podcast also, because I feel like the airwaves and YouTube and everything is just flooded with 22-year-old voices of fit bodies and wise people, wise because they go to the gym and eat kale. But I think what I wanted to kind of showcase is real wisdom and people's different points of view. Especially when you age, you learn so much more about yourself, about
right.
the world, about society, more than
And
when you're 22. you know
and because of history and the AIDS crisis,
hmm
our generation lost a lot
yeah,
of people from the
and
generation
brilliant people.
above.
Yeah,
So now it's our turn to be the good example and to survive and to live long lives and be good and live to show others in the younger generation how
yeah,
fabulous we can be as we're aging queens.
I agree, because I think it got hit hard. The Gen X and the late boomers. Um,
Bloomers.
bloomers, I would say. Hey, that's going to be a whole nother one. Once we start with now with the alphas and the Bs, maybe they'll be bloomers.
Oh my
Um,
goodness.
who knows? We haven't gotten into the Generation B yet, but the A's are coming.
Oh,
Um, anyway, there's a lot of food for thought here. I think it's a conversation worth having. I think people need to start talking to their loved ones and being smart
build
about this.
community.
Yeah, that's exactly what it is.
Building community starts at home and it
Yeah.
starts with your neighbors.
Yes.
And even though national legislation is important, it's also your local community is just as, if not more important. Making sure that services are there, making sure that things are funded, making
Right.
sure that people have the right access, people that making sure that we don't restrict access. Um,
And not only that, Robert, but even if it doesn't affect you today, it will in 20, 30 years.
oh
So
yeah.
things that you vote for and
Hmm.
social programs, especially that need to be funded today, um, think about the future, because those are
Right.
going to be programs that you're going to take advantage of and that you're
Yep.
going to use. It might not be an immediate effect in your life, but
Yeah.
it will be, you
That's
know.
why we shouldn't close the door behind us. Like
hmm
other people in age ranks have done, it seems like they've closed the door behind them because they've um, worked hard and lived life by their bootstraps and this and that the other, and then they just close the door behind them,
Are you beating up
restricting
on boomers
access.
again?
No, no, it's not just boomers, it's also Gen X. But I mean, it's,
You're a true
making.
millennial, you're turning 40.
I know I am. I'm an elder millennial,
You
as
see, I'm in the
the
middle.
TikTokers call,
I'm an exennial, I'm exactly exennial, I was born, late '70s, so
and you pronounce it like one too. Yeah.
that's right, exennial.
Hmm.
But anyway, I mean, we're special, the exennials, or, because I understand Gen X and I understand millennials. Actually yeah, I'm old enough to know both kind of worlds and perspectives. I
Yeah.
lean towards more of the millennials, just because I'm the youngest of four, and my older sisters are true Gen Xers. Um, so I feel like that age gap between me and my siblings also is a generation gap. So I can't say that I'm a true Gen Xer when I feel like there's that gap between me and my sisters and I. So anyway, I think these statistics are just eye opening. I think we have a couple more. If Robert, if you want to shoot one out to
Yeah.
discuss.
I just want to talk about here how here in Madrid, there's
Mm-hmm.
a association called the Foundation of the 26th of December,
Mm-hmm.
which is the first, maybe first in Europe, where it's a publicly funded from the government retirement center
Mm-hmm.
specifically for LGBTQ people. It's in Madrid. It houses
It's publicly funded. You say?
publicly funded, yeah,
Wow.
and it's specifically caters to LGBTQ elders that are living that are in quote unquote at risk
Mm-hmm.
of social exclusion. So I think the application process is a little bit different than another kind of publicly funded retirement community. But if you have a social worker, I'm sure there's ways to apply for it. I'm taking notes for myself for the future. But
Right.
it's they've got an Instagram, they've got a web presence. It's called the Foundation of the 26th of December, Fundación
Mm-hmm.
26 Diciembre, and it's really inspiring how they do events, they do trips, they do outreach, and I think it's a great model, and I hope that it's successful and they have more in the future
Yeah.
because, like we were saying, the statistics show that there's a lot of unique challenges faced by older LGBTQ individuals
Mm-hmm.
throughout the world, and especially the lack of inclusive services. Many elder care services lack inclusivity
Mm-hmm.
for us. A survey conducted by the National Research Resource Center on LGBTQ Aging found that only 22% of
Wow.
LGBTQ elders believed that they would have access to appropriate services as they age. And for non LGBTQ elders, that number's 62%.
Hmm.
So 22% of us believe that we're not going to have, 22% of us believe that we would actually have access to appropriate services when we get older in
Wow.
age, like retirement communities, etc. Um, so hopefully by the time that we're at that age, the situation improves. But the only way to do that is to ensure that things improve yesterday.
Yeah.
You know what I mean?
I agree. Look, there's another statistic. Well, actually, yeah, about 3 million LGBTQ adults over the age of 50 currently live in the US. And I think
Mm,
that's very liberal. But
mm,
as they grow older, they're having a hard time finding retirement communities that feel welcoming. A
mm,
2018 study by AARP showed 82% of LGBTQ seniors don't feel they have the social support they need as they get older.
mm,
This was an article at CBS News published August 17th, 2023. Um, and I think whether you go down the private model or the public model, as there is in Europe, you need to prepare early on. I feel probably earlier when you're a gay person,
mm,
because there are some of these meccas, such as Provincetown and Sitges and Palm Springs. But let me tell you, they're going to get filled up and they're not
mm,
cheap. So if you're going down the private model and you can do a little mix of private and public, um, it's something that I think we need to start thinking about earlier than even our heterosexual counterparts, for sure.
yep. Lots of work to be done.
Yes. So today, I'm so glad we opened and started this conversation. I don't feel like we're going to be able to cover everything. I do want to,
Oh God, we're
um,
not experts,
yeah, I
but
do
we're
want
opening
to.
up a door.
We're opening the door. It's all about having a conversation, shining some light on topics that are very much not talked about. Um, Again, I don't want to, throw shade at our younger counterparts who are on podcasts or in
No,
social
I
media.
love Gen Z.
I love
Gen Z
them.
for the win.
I love them all. The thing is, their voices are very much out there, and I feel like ours, 40 plus side, are not being heard as much. So I think we have our own concerns and in the community, and I think this is the reason why this podcast I think is a really useful tool for
Yeah.
anyone. So we will talk about this in future episodes more in depth. I wanted to start kind of the conversation so people start thinking and planting seeds. I think this is a lot for me personally to take in, and hopefully it'll
Oh,
help
me
all
too.
of our audience members, yeah, to prepare for the future. But anyway, well, Robert, thank you so much for helping, especially with looking up all these statistics, and
Yeah.
yeah, and starting the conversation. Hopefully, we will have a more in-depth conversation on this in future episodes. Well, that concludes today's episode. Thanks, Robert.
Thank you.
And please subscribe and like our episode and subscribe to our channel as we will be having more of these at the Aging Queen. Thank you and goodbye.
Bye.